My name is Debra Tasci, and I'm a police and public safety psychologist and substance abuse professional. I've been working in the mental health and addiction field since 1976 and as a staff psychologist with Nicoletti-Flater Associates since 1996. One thing I have learned during my academic and professional journey is that I personally have had limited influence or impact in disrupting an alcoholic or substance abusing family system, and sadly, neither do the children, the spouse, friends, motor vehicle, the judge, or even the physician. But there's one entity that did seem to have an impact and leverage, and that was the employer. So I decided if I was going to spend my adult life in a profession, I was going to have some impact, and I've been working in the field of employee assistance ever since, beginning in 1980. In 1987, I began working for Continental Airlines as the Western Region Manager for the Employee Assistance Program. It was here that I was introduced to the HIMS program, which I have the privilege of introducing to viewers today. HIMS stands for Human Intervention and Motivation Study, and is a model that is considered the gold standard for programs that are dedicated to identifying troubled employees, intervening, treating, monitoring, and returning public safety employees to duty. Originally started in the 1970s as a safety program for pilots, to protect the public and the profession, save the life of an alcoholic drug-dependent pilot, save the career of the pilot, and also as a resource for the family to get help. We've adapted the FAA-HIMS model for pilots to the first responder profession in much the same way the model has been adapted for physicians, nurses, pharmacists, and lawyers. There are fundamental assumptions a program like this is built on, that include the fact that alcoholism or substance use disorder is considered a disease as first identified by the American Medical Association in 1956. It's considered progressive, chronic, and has the potential for relapse. We know the average female alcoholic progresses from early to late stage alcoholism in 5 to 7 years, and the average male from 10 to 15 years. Early identification and treatment is possible, total abstinence is essential, and an employed employee is a motivated employee. And once we lose the leverage of the job, the outcome is often catastrophic. HIMS is not a recovery program, it's a monitoring program that begins with identification and evaluation, which leads to a substance abuse evaluation and, if clinically appropriate, treatment, followed by aftercare and no-notice alcohol testing and monitoring through peers and professionals for a length of a contract to be determined by relevant parties. What makes the HIMS program so successful? It is thought that the approximate relapse rate of individuals in AA and mainstream treatment is 60%. HIMS data reflects a relapse rate of 14.6% or an 85% success rate. This is achieved through monitoring and accountability done through monitoring agreements, also known as stipulation agreements, and last chance agreements. We know that among the majority of first responder agencies, an alcoholic or substance abusing employee is terminated when they get into trouble of some sort, or even through self-report. Unfortunately, this typically drives the problem underground. I'd like now to discuss the first step in this process, which is identification. The first task of creating a program begins with the identification of a troubled employee based on either a failed drug and alcohol test conducted either for a line of duty accident, incident, or for probable cause, operational or training problems, excessive sick leave, peer concerns, supervisory and professional standards issues, a DUI or alcohol-related offense, drama, or self-report. It is imperative that an investigation should always be conducted prior to what comes next, which is an intervention. An intervention is defined as a face-to-face meeting with the employee and one or more concerned individuals. The goal of an intervention is not to get the first responder into treatment, but only to get him or her to agree to a professional evaluation. If an employee agrees to undergo an evaluation, they are referred for a substance abuse evaluation with a qualified substance abuse professional. Should an employee be classified as substance dependent, they will be referred to treatment. Upon completion of treatment, an aftercare program will be outlined to include a monitoring component. Monitoring then takes place for a length of time to be determined by the employer with a team of peers and professionals and includes no-notice testing. We know that 70% of recovery takes place in monitoring, and that typically the first year of recovery is physical healing, the second year is emotional healing, and the third year is relational. Now, I'd like to briefly discuss the costs of neglecting to have formal policies and procedures in place, as well as the return on investment. Relative to costs, aside from helping employees, saving lives, careers, and families, and doing the right thing, I want to address several other areas that are important as to why this even matters. We know that binge drinking is defined as 4 or more standard drinks for a woman and 5 drinks for a male on one occasion. This risky behavior is one consequence of repeated binge drinking and for increasing the risk for developing an alcohol use disorder. Binges cause hangovers, and research indicates that when hungover, individuals have a reduced ability to retain information in their short-term memory, multitask, switch attention between tasks, and focus on a goal. This impairment is likely the result of reduced capability in several core executive functions, which are important for tasks such as workplace performance, as well as driving. A review of 19 studies found that being hungover impaired psychomotor speed, short and long-term memory, and sustained attention. Impaired performance in these abilities reflects poor concentration and focus, decreased memory, and reduced reaction times the day after an evening of heavy drinking. Return on investment. In conclusion, data collected by the HIMS program since the 1970s indicates that the substance abusing employee returning to work after treatment uses 75% less sick time the first year back to work than before they went to treatment. This is an illness that inherently comes with economic costs, shame, and stigma for individuals who pride themselves on their ability to control complex and dangerous situations. They are loath to admit they have lost control of their alcohol use. We can help them through education, policies, and programs that encourage early identification, treatment, and recovery. If you are interested in developing a HIMS program for your agency, please contact us at Nicoletti-Flater Associates or HIMSprograms.com. Thank you for your time and attention today.